Hi everyone! Today I want to show you how to do a PerioMonitor chair-side saliva test. First you need a cup of tap water, an empty clear cup from the PerioMonitor kit, a vial of water from the kit as well, this dipstick that comes with the kit. You're also going to need the color chart so that you can compare your result. And lastly, you're going to need a timer. I've chosen my phone and I've set up 15, 30 second, 1 minute and 2 minute timers. So that'll keep things easy for me. Step 1, I'm going to do a pre-rinse. So I'm swishing with tap water for 15 seconds. I spit out the pre-rinse, and now I'm setting my timer to 2 minutes. The purpose of this 2-minute timer is just to wait because we're waiting for the neutrophils to repopulate the saliva. This will allow for the most accurate test. Now, while I'm sitting and relaxing with you guys right now, if I was chairside with the patient, I would be reviewing their health history, asking about medications, perhaps taking blood pressure, maybe even asking about their oral hygiene habits or any dental concerns. As I'm getting close to the end of my 2-minute timer, I'm taking a moment to open the water vial and I'm emptying the contents into the empty cup. Please use all of the contents of the vial. Once the timer is up, I'm going to swish with the contents of the vial, this time for 30 seconds. "30 seconds are up. I spit back into the cup, take the dipstick, and I'm going to immerse the indicator pad for 1 second and then lay the indicator strip flat on the tabletop or countertop and set a timer for 1 minute. After 1 minute has elapsed, you can read your PerioMonitor result, comparing the color of the indicator pad on the test stick to your color chart. If you find yourself between two colors, you always round up. A low or negative response is generally healthy, whereas a medium or high score means that inflammation is present, and seeing high scores may help your patient to see why it is so important to do x-rays, full mouth probing, a comprehensive hygiene appointment, as well as to recognize their role in helping to reduce biofilm with better home care to achieve better results. Okay, timer's up. Let's compare our results. So you take a look at your chart and the color on the test strip, and yay, we haven't gone purple. So you've got one happy hygienist here with a negative score. That's how you do PerioMonitor.